Hello, Ali Motamedi, orthopedic surgery with Ventura Orthopedics and sports medicine. Today I'm going to talk to you about anterior cruciate ligament injuries, also known as ACL tears. This is a model of the knee. So if you look at the knee and remove the kneecap out of the way, there are 4 ligaments, medial, lateral, that are on the inside and outside of the knee, and then 2 ligaments are internal. First one is the anterior cruciate ligament, second one is the posterior cruciate ligament. So today we're going to talk about ACL tears. Usually ACL tears can happen as a result of a sports injury. Most of the time they are non-contact from hyperextension, awkward cutting, or landing where the knee gives out. Most patients will feel a pop and have immediate pain and swelling. Sometimes the injury could be from a contact sports. Once the anterior cruciate ligament is torn, it cannot heal on its own. So what happens is that ligament is no longer functional and can result in instability. The instability is called anterior instability, and what happens is, again, when the ACL is torn, anytime you perform any cutting or pivoting movements, the tibia or the shin bone can pop out of position and then pop back, and that can result in the knee locking up or the patient falling. Some patients are able to compensate for a lack of a torn ACL with physical therapy, and there are special braces that sometimes athletes can use, and that compensates for a lack of ACL, and patients can return to some level of sporting activities, although those are lower demand situations. Most people are not able to return to activities unless they have the ACL taken care of surgically, and the surgery is what we call a reconstruction. And the reconstruction means that we put a new tissue in there to regenerate a new graft. And typically we use part of the patient's own tendon. The most common is to use part of the front of the tendon of the knee, called the patellar tendon, with some bone from either side to reroute that into the knee. You can also use part of the hamstrings or cadaver tissue. And what we do is do an arthroscopy, take a look inside, and what we end up doing is creating tunnels into the bone and then rerouting the prepared tendon as they graft into the tendon and replace the ACL. So what you see here is a hole here, a hole here. This is a representation of a patellar tendon with bone that's placed into the tissue, and then metal screws or bioabsorbable screws that hold it in place. The tendon that we put in there acts as a scaffold. The body will bring in new cells and regenerate a new ligament. That process typically takes about 6 months, and hopefully at that point patients are recovered and able to return to playing sports. Thank you.